இல்ல தப்பா வருது. Yes, sir. Sir, SCG 3, sir. Good health. Good afternoon, everyone. Our topic for today is one of the 17 goals of sustainable development, that is SCG 3, good health and well-being. Before we go into our topic, let's recall what we have learned about SCG 3. So, SCG is adopted by United Nations in 2015. These goals is adopted in order to protect the planet and end poverty. They are planning to adopt these goals and ensure that this by 2030 to ensure peace and prosperity. These goals are adopted by 193 member countries. When we talk about SDG 3, SDG, it involves 17 goals and all of these goals are interrelated, which means when there is an action being taken in one of these goals, it will directly or indirectly affect some other goals. For example, if there is an improvement being made in SDG 6, that is clean water and sanitation, it will definitely improve SDG 6, which is good health and well-being. In such way, each of these goals are interconnected with each other. Now our topic SDG 3, good health and well-being. The motto of this goal is to ensure healthy lives and promote well-being for all at all ages.
Good afternoon everyone, I am Aishwarya. I am going to talk about SDG 3. SDG 3 ensure healthy lives and well-being for all at all ages. It aims to prevent needless suffering from preventable diseases, and its key target to boost the health of the country's overall population. And its priority areas are neglected population groups. Importance of SDG 3, improved health and economic impact. Improved health means it aims to ensure healthy life and promote well-being for all at all ages. Achieving these goals means reducing maternal child mortality and improving overall health, which directly related to the health of the which directly related to the quality of people's life. Economic impact, a healthier population. Economic impact, a healthier population is more productive. Economic impact, a healthier population gives more productive to the economy and it leads to economic development. It aims to contribute poverty reduction and economic development.
Good afternoon to one and all present here. Myself Jivita. First one is epidemic preparedness. Epidemic preparedness is nothing but it is measured set of goals and actions taken by government, communities and healthcare systems. It is a crucial component of United Nations Sustainable Development Goals. Under specifically 3, it ensures lives and promote health and well-being to all at the ages. Already she said. Preparing for epidemic is essential to prevent and respond healthcare emergencies and strengthening healthcare populations. Reduce the impact of infectious diseases and minimize the impact of communities. It reduce the burden of diseases. In COVID pandemic, to ensure timing access to treatment and medicines to all the peoples through prevention and effectively. Second one is inclusivity. Inclusivity is nothing but everyone should have access to good health and well-being regardless of age, gender, inequalities and geography. It diversify the good lessons of wealth. Good diversity promotes inclusivity and reduce health disparities.
Good afternoon everyone, I am Jayvarshini. Now let's see about interconnected goals. SDG 3 is closely linked to sustainable development goals such as SDG 1 no poverty, SDG 2 zero hunger, SDG 4 quality education, and it promotes mental health and well-being. Long-term sustainability. Promoting mental health and well-being is not about creating intermediate benefits but also creating sustainable healthcare infrastructure to promote mental health and well-being. Overall, it is to achieve mental health and well-being in individuals, communities and nations.
Now SDG 3 measurable targets. There are 13 measurable targets that come under SDG 3. The first one is reduce maternal mortality, which their target is to reduce the maternal mortality ratio to less than 70 per 1 lakh lives. Now what is maternal mortality? So when we talk about maternal mortality, it involves a number of women who die from pregnancy related causes during pregnancy or within 42 days of pregnancy termination. Such deaths come under this maternal mortality. What's prevalence about this target is its prevalence in developing countries than in developed countries, which means the maternal mortality is more in developing countries than in developed countries. And then there is skilled birth attendant. When we talk about skilled birth attendant, it involves doctors, nurses, midwives. Midwives are those nurses who specialize in maternal related wards. These persons are crucial in this maternal mortality because they help in reducing this maternal mortality and acts as a life-saving persons. 90% of this maternal mortality is incurred in low and lower middle income countries. Between 2000 and 2017, the maternal mortality has been dropped by 38%, which is good, but still 810 women die every day due to the childbirth, maternal mortality. As you can see in this data, the higher amount of maternal mortality happens in this part of North Africa. This part of North Africa, which is shown in the dark red color, which means 1,000 to 2,500 deaths occur each year. Whereas the lowest maternal mortality occurs in this part of Europe, which is shown in that light pink color, which shows 0 to 10 maternal mortality. Whereas when we talk about India, India is at the level of 100 to 500, which is shown in this orange color, which means it is at the level of 100 to 500 deaths per year. Whereas about skilled birth attendant, 40% of all countries have fewer than 10 medical doctors, which is shown here as the most skilled birth attendant are here in this part of Russia, whereas the least skilled attendants are there in this part of Africa. When we talk about India, India is at the level of 75 to 90%, which is shown in this orange color.
SDG 3 aims to SDG 3 aims to reduce mortality rate and child mortality rate. Mortality rate means a children who dies before reaching the age of 5, and neonatal mortality means babies who dies before reaching the age of 28 days of age.
Fight communicable diseases. By 2030, end epidemics, we fight communicable diseases like HIV, malaria, tuberculosis, waterborne diseases and other diseases. The first one is HIV. The HIV/AIDS response is reduced to number of affected HIV fewer than 2 lakh in 2030. The second one is tuberculosis. Tuberculosis incident in 1 lakh per population. And third one is malaria. The indicator is used to measure the trends in malaria mobility and to identify the location where the risk of the population is highest. Fourth one is hepatitis B infection. This is measured indirectly at the child of 50 age when hepatitis B infection is effective. Next, this chart shows malaria incidents in 2020. Second one is HIV incident 2000 to 2021. In 2000, decrease in HIV affected people. In 2021, slightly decreased because of prevention and treatment effect. This is incidence of tuberculosis in 2020. Thus, children with an active hepatitis B infection in 2020.
Next, we are going to see about reduce mortality from non-communicable diseases and promoting mental health. By 2030, reduce by 1/3 premature mortality from non-communicable diseases. It should be prevented, and treatment should be made and promote mental health and well-being. Next, mortality rate attributed to cardiovascular diseases and cancer, diabetes or chronic respiratory diseases. It is defined as the percent of 30 years of old people who would die before 70 years of age because of these diseases, not other than these diseases. Next, suicide mortality rate. It is the number of deaths from suicide. 1 lakh people from the given population. It is to be avoided by promoting mental health and well-being. Here this slide talks about expected share of deaths from non-communicable diseases, which is in 2019. The estimated share of 30 years of old people who would die before 70th birthday from any of these cardiovascular disease, cancer, diabetes or chronic respiratory diseases. Second diagram talks about suicide rate in 2019. Annual rate of suicide per 1 lakh people who would die because of social stigma and legal concerns.
Prevent and treat substance abuse. The target is to prevent and treatment of substance abuse, including narcotic drug and harmful use of alcohol. When we talk about substance abuse, what is substance abuse? Substance abuse means excessive use of alcohol or any other substance which is detrimental to the self, society or both. This target includes the actions aimed at reducing the supply, reducing the demand, increasing education, health promotion about the substances and disease prevention. When we talk about substance abuse, the one of the substance which is most used worldwide with 192 million people using it is cannabis. Any one of you know what cannabis is? We all have heard about it. Cannabis, we all know about it. It's a drug. It's a kind of drug. No. It's what we call marijuana. கஞ்சான்னு சொல்லுவாங்கள்ல தமிழில், அதுதான் கேனபிஸ். ஸோ அதில் அஃபெக்ட் ஆனவங்க தான் அதிகம், அதனால சப்ஸ்டன்ஸ் அப்யூஸ் வந்தவங்க தான் அதிகம். வேற ஓபியான்றது இட் இஸ் ஒன் ஆஃப் த மோஸ்ட் ஹார்ம்ஃபுல் சப்ஸ்டன்ஸ் விச் லீட்ஸ் டு 71% ஆஃப் டெத். ஸோ யுஃபோரியா சீரீஸ் பார்த்துருந்தீங்கன்னா அதில் த கேரக்டர் கால்ட் ரூ விச் இஸ் டன் பை ஜெண்டையா, ஷீ இஸ் அடிக்டட் டு திஸ் ஓபியாய்டு. இட் இஸ் யூஸ்ட் அஸ் painkiller medicine. Her father used to take that medicine. She knowingly or unknowingly take that medicine, started using it again and again, and it leads to overdose. Such opioid overdose leads to 71% of death worldwide. And then there is harmful use of alcohol. So when we talk about alcohol, we all know that excessive use of alcohol is considered as a kind of substance addict. So this chart shows the number of people with substance alcohol use disorder. As you can see, the highest amount is from that part of Russia, which is 20 to 24%, whereas the lowest part is from this part of Kuwait and northern part of Africa. And when we talk about India, India is at the level of 4 to 8%. Whereas the alcohol consumption per person, globally alcohol consumption per person kills leads to 2.8 million premature deaths as it shows. As you can see in this chart, alcohol consumption per person is highest in East Africa and lower in Saudi Arabia, whereas India is at the level of 4 lakh to 6 lakh alcohol consumption per person.
It aims to reduce road injuries and deaths by 2030, reduce the number of global deaths and injuries from road accidents into half. This shows the percentage of road accidents happen in each countries. In India, it's about 20 to 30% happening road accidents in India.
The seventh target says universal access to sexual and reproductive family planning and education. It includes family planning and information education or integration of reproductive health and national strategies and programs. And the 7.1 target says the indicator incorporates two components: the privileges of modern method of contraception and the share of women reproductive age who wants to stop delay childbearing but not using any method of contraception. The next. The next one is adolescent birth rate. This improvement depends on reducing adolescent facility and treating the various variables like contribute to it. This is the adolescent birth rate 10 to 14 years old in 2021. The number of live birth 1000 women aged 10 to 14 years old.
Achieve universal health coverage, financial risk protection, quality healthcare services and affordable medicines and vaccines. It should be promote mental health and well-being in a society. All peoples and proportion of the target population covered by essential health service. All peoples and communities should receive medicines and other health services without any financial trouble. to find financial trouble in health as well as a household caused by mental health. Next slide. Next we are talking about share of population with very large expenditure on health. It spends 25% of total household expenditure on mental health. Next, the universal health coverage UHC service coverage index in 2019, it is 0 worst to 100 best, based on the average coverage of essential services including reproductive, maternal, childbirth and newborn, etc.
So next one is reduce illness and death from hazardous chemical and pollution. Their target is to reduce this pollution from air, water and soil pollution contamination. When we talk about air pollution, it involves both outdoor as well as the indoor air pollution. An epidemiological study shows that this air pollution causes respiratory infections, cerebrovascular infections and lung cancer. Now 91% of the world population is living in a place where WHO air quality is not met. And then there is mortality from sanitation and lack of hygiene. It involves death due to the lack of sanitation, which causes diarrhea, cholera, malnutrition and acute respiratory infection. And there is unintentional poisoning. So unintentional poisoning means the deaths due to exposure of household chemicals used in products, snake bites, etc. This data shows the death rate attributed to unsafe water, sanitation and hygiene, and that shows the unintentional poisoning.
SDG 3 aims to implement the World Health Organization framework on tobacco control in all the countries. This shows the data of tobacco users in each countries. In India, about 25 to 30% of tobacco users.
Support research, development and universal access to affordable vaccines and medicines. In accordance with Doha Declaration on the TRIPS Agreement and mental health, it is to utilize the TRIPS agreement's provisions pertaining to trade-related issues. Next, proportion of the target population covered by all vaccines included in their national program. In this, 4 following indicators are there. First, 3-dose diphtheria, pertussis and tetanus DPT3. Second dose molasses vaccine. Recommended dose of pneumococcal conjugate vaccine PCV3 and recommended dose of human papilloma virus. Total net official development assistance ODA to medical research and basic health sector. It is an indicator to measure the payment of official development assistance ODA for medical research. It is the proportion of health facilities that have a core set of relevant essential medicines available and affordable on a sustainable basis. It is to measure the share of surveyed healthcare facilities.
The increased health financing and supporting health workforce in developing countries. These are the crucial steps improving healthcare system and achieving better outcome for their populations, and also increase financing and requirement, development, training and retention of health workforce in developing countries, especially in least developing countries and small island developing states. The C.1 target says health worker density and distribution. It is the health worker density and the distribution. It is the size of health workforce in 1,000 people. It is measured here based on density, physicians, surgeon, nurses and midwives density and paramedical personnel. These are the health worker density and distribution. Thank you.
Last slide, sir. Sir, last one. Last solid da pove. Last slide. Tell me. The last slide. So last slide is to improve our early warning system for global health. It involves all these 15 capacities: policy, financing, laboratory, surveillance, human resource, health emergencies, health service provision, infectious prevention, risk, zoonotic disease, food safety, chemical events, etc. This data shows the level of these 15 capacities. Thank you, sir.
This team has presented more information than any other team earlier presented. Please. இந்த ப்ரெசன்டேஷனில் இன்ஃபர்மேஷன் அண்ட் ஃபேக்ட்ஸ் வந்து நிறைய இருக்குது. ரைட், தே ஹவ் டன் ஆக்சுவலி மோர் ஒர்க் டு ஃபைண்ட் திஸ் இன்ஃபர்மேஷன் ஒவ்வொரு கோலில். ரைட், மற்ற ஸ்டூடெண்ட்ஸுடைய
RL Institute of Management Studies, TVR Nagar, Arupukottai Road, Madurai 625022. Email ID rlims@rlims.in. Contact number 95006 65581.